program is sponsored by
Lanka Hospitals, caring, curing. Here at our groundbreaking ENT Center, we perform many complex inpatient and outpatient procedures every day. Our comprehensive and specialized ENT Center offers consultations, audiology services, speech and language therapy, and ENT surgeries under one roof. We are the pioneers in cochlear implant surgeries and KTP laser ENT surgeries, backed by superior technology and renowned ENT surgeons. Lanka Hospitals, caring, curing.
Welcome, you're watching our television and a special program about Lanka Hospital. Joining me today is Dr. Devanand Jha, consultant ENT surgeon, Lanka Hospital, who has been with Lanka Hospital for 17 years. Since 2002. Welcome to the show.
Thank you so much
Dr.
for
Jha.
getting me on the show.
Lanka Hospitals is known for being in the forefront of almost all the areas when it comes to a hospital. When a person who wants to get treated, he can get everything done under one roof. So doctor, this ENT center is special. People talk about it. You've been served for the patients of ENT for over 17 years. What's special about this ENT center and what do you all do?
Yes. Just a brief outline for the services that we offer to the patients. The ENT stands for ear, nose and throat disorders. And patients suffering from any of these three disorders, when they come to Lanka Hospital, the first thing we do is a clinical examination and make a diagnosis. And after the diagnosis is done, we ask for relevant investigations, and based on the investigations, we give them further treatment, which can be either medical treatment or surgical treatment, depending upon the diagnosis and depending upon what the patient requires. Now, Lanka Hospital has been in the forefront for diagnosing some of the very difficult diseases that the patients have had. They have also been in the forefront for introducing some remarkable surgeries which was never done in Sri Lanka before. And some of them, of course, are game changers in the history of ENT surgeries in Sri Lanka. And I take pride in being part of a history that Lanka Hospital has created.
Absolutely. You should definitely be rewarded or appreciated for the initiative that you took 17 years ago, doctor.
Thank you so much.
How does these hearing problems occur? Like how do they start?
Yes, many of these hearing problems, if we look at hearing problems in general, then they can be either from birth, which are called congenital disorders, or they can be acquired, which means you are normal at birth, but over a period of time, because of any disorder, you have a hearing problem, which are called acquired disorders. Now, congenital disorders can happen at birth due to any problems the mother suffered during her pregnancy, which can be in terms of, say, having virus infections while she was pregnant, or she took some medications which affected the hearing of the newborn. And of course, conditions during the course of pregnancy or in the early pregnancy can also impact the hearing of the child. And the acquired disorders can be because of infections that a person gets, or occasionally tumors, or some of those genetic disorders which do not show at birth but they do manifest or they do show later on in life, and those are the usual causes of hearing problem. And when a patient who comes to us with a hearing problem, first we have to know the history as to whether it has been there from birth or whether they have got this hearing problem later on in their life. Now, the difference that our hospital has made is that nowadays we are diagnosing hearing impairment right at birth. So, what we are doing is something which has been there in the advanced countries for a couple of decades now, and we are proud to be part of this journey, wherein we have started diagnosing the hearing condition of every newborn in Lanka Hospital, and to know whether the child is hearing normally or not. That's called neonatal screening program. So we are doing a screening of all children born at Lanka hospitals. So that is, we are trying to, once when we do a neonatal screening, then the result is either pass or refer. So when it is pass, then we know that child is hearing at birth, and when it is refer, then we do some more specialized tests and then come to a conclusion how weak or how bad the hearing is by doing some more specialized tests. Now, the biggest advantage of catching them right at day 0 or day 1 when the child is born is that we can intervene at a very early stage. Now, hearing is an issue wherein if you intervene at an early stage, in most instances, the children become normal. So, to give an example to the public at large, several decades ago, children who were born deaf and dumb, they were the scourge in the family. The family members would be very sad that they have a child who is born deaf and dumb, because he was consigned to being deaf and dumb his whole life. Welcome to the new era. Now, in the new era, if a child is born deaf and dumb, if the treatment and the diagnosis is done early in life, which means in the very first year in life, then we can intervene, and we can intervene and make them normal children. So, we have intervened in many of these children, and some of these children are going to normal school, and I have operated on a child who is going to UK to do his advanced studies. He was born deaf and dumb. So that's the kind of miracle that modern technology is doing in today's world.
What are the advanced technologies that you use to cure these impairments, doctor?
Yes. So at the outset, I would like to tell our viewers that Lanka Hospital has been a pioneer of the cochlear implant operation, and I'm very glad to be an Indian and yet put my whole effort in starting this implant surgeries in Sri Lanka. So I'm very proud to do that, and we started this journey around 15 years ago. In September 2004, we did our first cochlear implant, and
it's called the cochlear.
It's called a cochlear implant, wherein we put a device in the profoundly deaf patients or profoundly hearing challenged patients. That's a terminology to use now, and that device tends to activate the hearing nerve of the patient, and they start hearing again. So then we started having lot of hearing challenged patients. Now, the challenge for us at that particular point of time was that technology was new. Patients were not aware that something was available for them. So, we had to advertise a lot in media, informing the patients that yes, if you have a child who is born deaf in your house, that's not the end of the world. We have technology, we do operations on you, and then we can make your child, a deaf child, into an absolutely normal individual who can go to a normal school, become a normal person. So that was something that we started way back 15 years ago. Message started spreading to the patients, and then we started having lots of patients coming to us with a similar problem. Now, the message that we want to give it out to the viewers at large is that the diagnosis of hearing impairment should be done as soon as possible, when the child is very, very small. So nowadays we are doing it at birth, but if the parents feel that the child is not hearing well or the child is not hearing at all, they should take to a doctor immediately and get the investigation done, and of course get the surgery done as soon as possible. Intervention at the right time makes a lot of difference, where we can change the outcome of what the child will have in future.
Yeah, doctor. I recently saw a video of a child hearing her mother for the
Yes,
very first
first time,
and that's very emotional.
That's
doctor.
a very emotional moment. Patients
Yeah.
respond very differently. Some
Absolutely.
start crying and some are shocked, because it opens up a new space for you.
Any experience that you
Many a times. Many a times.
For 17 years.
Yeah. Many a times. I have done 111 cochlear implants in Lanka Hospital, and I'm proud to say that Lanka Hospital is, of course, the only private sector hospital which has done so many implants. And it was very rewarding to see those small children when we actually switched on the device. The switch on of the device is done a month after the implant is done. So when we switched on the device, they had a new sensation for the first time in their body, which was a hearing sensation, because they were not born with that. And small children responded such wonderfully to that kind of sensation. I mean, it's so gratifying to see that. Yes, you're absolutely right. The sensation is absolutely beautiful.
This is interesting, doctor. So, but we have to go to a short commercial break. Let's go to a short commercial break and come back soon. Stay tuned for this special program about Lanka Hospitals on our television.
You're watching this program sponsored by
Lanka Hospitals. Caring, curing. Here at our groundbreaking ENT Center, we perform many complex inpatient and outpatient procedures every day. Our comprehensive and specialized ENT Center offers consultations, audiology services, speech and language therapy, and ENT surgeries under one roof. We are the pioneers in cochlear implant surgeries and KTP laser ENT surgeries, backed by superior technology and renowned ENT surgeons. Lanka Hospitals. Caring, curing.
Welcome back. You're watching a special program about Lanka Hospital on our television. Joining me today is Dr. Devanand Jha. Doctor, Lanka Hospital is believed to be the pioneer of Coblation ENT surgeries. What's this all about?
Yes. Coblation is a technology which is nearly a decade old now, and I'm proud to say that we started this Coblation surgeries in Lanka Hospital almost 10 years ago. Now the other hospitals have also taken it up in a big way, and they have taken it up in a big way in the last couple of years, but we are again pioneers in Coblation surgeries. Coblation actually is controlled ablation, and now for your viewers, just to explain to them in simple terms as to what it means, is that when a surgeon is doing an operation, then the most common tool that he uses besides the knife is cautery. And a cautery is something, it's an instrument which is used to either cut or control bleeding. Now when it is cutting or controlling bleeding, that's at a very high temperature. So it causes damage not only to the area that you are cutting, but also in the adjacent areas, because the temperatures are very high. Now when I saw this technology 10 years ago, what it utilizes is that it utilizes the salt water to generate plasma and dissolve tissues at a much lower temperature. So the collateral damage done is much less. So in simple terms, this technology causes less damage to surrounding tissues and only operates the area that you are concerned with. And this particular technology was initially being used in orthopedics, and that's where the idea came to incorporate it in other departments. So now it is being used in mainly nose and throat surgeries, not so much in ear now, but yes, mainly in nose and throat surgeries, where the surgeries for the tonsils and surgery for the adenoid. Now tonsil and adenoid surgeries are very common, and still the cold steel was being utilized, cautery was being utilized, laser was being utilized, but nowadays coblation is something that has changed the game, and the pain is much less. The child can go home earlier, they can go back to school earlier.
Also,
So,
Dr. Jha,
yeah.
could you please, sorry for interrupting,
Sure.
could you please educate our viewers what are the coblation surgeries that take place at Lanka Hospitals?
Yes. So, as I explained, primarily we are doing coblation in the throat and coblation in the nose. In throat, we are doing surgeries for tonsil, that's called coblation tonsillectomy. Then we are doing surgery for adenoid, which is like a tonsil behind the nose. So, if you see children who are snoring, who are not breathing very well, they possibly have large adenoids, and we use coblation to remove the adenoid, where the bleeding is almost zero. The downside of adenoid surgeries, where the parents were very scared, was bleeding. The children would bleed quite profusely after the surgery, but fortunately with the coblation technology, bleeding is near zero. Child goes home the same evening. We also use coblation in larynx or the voice box, wherein the reach is far down from the mouth, and we need longer instruments, safer instruments to access those areas as we operate, and coblation does that job beautifully. We also use coblation in nose surgeries and skull-based surgeries. Skull-based surgeries means an area where the neurosurgeon and ENT surgeon, they work together and in tandem, and in those areas coblation works very well, because we need very precise, we do not want too much tissue damage, and we need precise surgery, and coblation works very well in those areas.
And doctor, like we spoke about babies,
Yes.
like you should identify the hearing problems at the initial stages.
Yes.
But someone who is living his life normally, how can he identify if he has some sort of issue
Yes.
related to ENT?
Yes. So, it's very simple. How will you identify whether a normal working person, whether he has a ear, nose or throat disorder? In most instances, the ear is such a sensitive organ that the moment you don't hear, it will feel like a block. There is nothing happening on one side or the other. Or you will have a severe pain, so you will come rushing to the doctor. So, ear is something that will make you run to the doctor immediately. It's very easy to diagnose and to get yourself treated on that. The nose and throat, of course, are also simple. You may have throat pain or you may have nose discomfort. But more importantly, something for the viewers I'd like to tell them is that if you have a ear problem, do not attribute everything to having wax or dirt blocking your ear, because many a times silent virus infections can affect your hearing nerve and you lose your hearing, and all the while you feel that there's some wax blocking your ear, and you may ignore and come to the doctor later on, and it's too late. So, a message for the viewer is, if you have an ear problem, please go to an ENT specialist as soon as possible. Nose and throat, of course, you can get your GP to treat it, or you can come a little later. That can be treated later on. But ear is a very sensitive organ. Get to an ENT specialist as soon as possible if you have a ear problem, because most of the ear problems, if treated immediately, can be reversed.
Also, doctor, when you get a block, some people put their keys, or they put earbuds to whatnot. Anything that comes to your hand, you roll a paper or put it inside.
Yes.
How will this impact
Yes.
in the future?
We see a lot of damages being done to the ear canal and the eardrum by varied number of objects which the human mind can only imagine, right from pins to bird feathers to everything, and you name it and it's there in the ear. You find varied number of foreign objects in the ear. And the message to the viewer is that do not touch the ear. God has given you an organ to hear. Let enjoy that. A bit of a dirt in the ear is essential. It protects you from dust and bacteria. The dirt is wax. Do not call it dirt. It's wax. So it has not to be cleaned. It should remain in the ear. Only when it causes a block or a hearing problem, or if you have pain, do you need to see your doctor. In a normal day-to-day practice, just to clean your ear is not advisable. Do not clean the ear. Just forget that ears exist in your body.
Dr. Lanka Hospital is the only private hospital in Sri Lanka to offer KTP laser treatment. What's this service all about?
Yes. You see, laser is a technology or a device which helps a surgeon to work in very narrow areas very precisely. And we are fortunate to have KTP laser at Lanka Hospital, and it tends to address the lesions or diseases which are normally not accessible by a cold steel knife or normally not accessible for surgery. But with laser you can be more precise, and you can do a better surgery with this KTP laser. KTP laser has a special property wherein any vascular lesion, especially vascular lesions in areas which are very tiny, for example, to the viewer, inside the middle ear, deep inside the middle ear, if you have any vascular lesion, which means if any disease which has small blood vessels in it, then KTP laser, the blood vessel absorbs the KTP laser, and the lesion or the disease tends to shrink. So it works very nicely. But if you do not have KTP laser and you are using, say, a knife or a cautery, then you tend to cause a lot of collateral damage. So the laser technology in our hospital has helped us to be more precise in how we operate and be more accurate in our surgeries, because ear, nose and throat disorders require precision, require accuracy. You cannot run a long knife into the ear, nose and throat areas. You have to be very precise. So KTP laser actually has given us a big boost or a big impetus to do our job more accurately and precisely.
And it's safe.
And it's very safe. Yes, it's very safe. In fact, I wanted to tell our viewers that we have also been at the forefront of a surgery called Stapedectomy. Now, Lanka Hospital has been doing it for the last 16 years. This was something very new to Sri Lanka. Most of the patients from Sri Lanka would go to India for these surgeries. But ever since Apollo started in 2002-03, we have done almost 500 of these operations, and they have been very successful. We have almost over a 90% success rate. What we do in this surgery is that there are 3 bones of hearing. So it's the third hearing bone that has a defect. So we remove the third hearing bone and put a piston. It's a very fine surgery, and in the initial stages there can be a lot of hearing problems for surgeons who are not trained. Unfortunately, we have trained surgeons at Lanka Hospital, and our success rate for stapedectomy is very high, which is also appreciated by our peers in Colombo. The ENT surgeons do appreciate that Lanka Hospital does tend to offer the best service as regards stapedectomy is concerned in the whole of Sri Lanka in the private sector.
What are the other messages that you have to give to our viewers related to ENT?
Yes. I'll again specify on the ear aspect of it. If you have an ear problem, see an ENT surgeon immediately. Nose and throat problems, of course, it's difficult for the general practitioners to diagnose, because we are dealing with areas which are small, which are inaccessible. Nowadays, the ENT the profile has changed a lot. In the olden days, we would use a torch or we would use a headlight to see. Now we have fantastic diagnostic equipment. We can see everything in minute detail. So please utilize those devices that we have, those gadgets that we have to make a diagnosis. Lanka Hospital is at the forefront of these. We have all gadgets available to make an accurate diagnosis of your ear, nose and throat problem. So get a diagnosis done rather than imagining a diagnosis and treating that imagined diagnosis.
ENT is something which comes with emotions, if I'm not mistaken.
Yes, it does.
That's
yes.
a blessing. We
Yes,
should protect those, doctor.
Yes.
So what is your message for the 21 million people in Sri Lanka
Yes.
to practice
yes.
daily?
Yes. The people in Sri Lanka are very health conscious anyway. There is very little to tell them. But certainly what I would like to put out to the people in Sri Lanka is that if you have a ear problem, do get it treated or checked immediately by an ENT surgeon. The GPs of course can be a first line of treatment, but I would certainly recommend to go to an ENT surgeon straight away. You can go to a general practitioner for your nose and throat problem, but for ear problems I would highly recommend to go to a ENT specialist.
Thank you very much, Dr. Devanand Jha, for sparing your valuable time despite your busy schedule on this special program on our television.
Thank you so much for having me here. It's been a pleasure talking to all of you.
That marks the end of the special segment about Lanka Hospital. If you've got any inquiries to the ENT Center at Lanka Hospitals, please call the hotline on the screen. Thank you very much.
This program was sponsored by
Lanka Hospitals. Caring, curing. Here at our groundbreaking ENT Center, we perform many complex inpatient and outpatient procedures every day. Our comprehensive and specialized ENT Center offers consultations, audiology services, speech and language therapy, and ENT surgeries under one roof. We are the pioneers in cochlear implant surgeries and KTP laser ENT surgeries, backed by superior technology and renowned ENT surgeons. Lanka Hospitals. Caring, curing.